Very good morning, one and all. I'm going to present you uh, on the topic bonding in orthodontics. Uh, Coming to my contents: introduction, history, basic bonding procedures, materials used in bonding to crowns and restoration, protective self-ligating bracket indirect bonding, rebonding, recycling, debonding factors affecting bonding. Then conclusion. Coming to the introduction of bonding to orthodontics has had a dramatic effect on profession. Orthodontics attaches or fixes the brackets over the enamel surface of the tooth by an adhesive resin. The method is called bonding, and which eliminates the disadvantage of banding each tooth as previously used. Then coming to the history part. In 1955, Dr. Michael Winokur first proposed the basis for the addition of brackets to enamel etching with phosphoric acid. In 1962, Bowen's resin was designed to improve the bond strength and increase the dimensional stability. In 1965, Newman with advent of epoxy resin bonding began to apply these findings to direct bonding of the orthodontic attachment. In 1970, Mayura developed a technique for bonding polycarbonate plastic bracket to the phosphoric acid etched enamel using restorative filling material. In 1974, Dentsply first introduced fast single paste UV light curable bracket adhesive. Then in 1977, fast detailed post treatment evaluation of direct bonding over a full period of orthodontic treatment in a large sample of patients was published. Then basic bonding procedure. What are the basic bonding procedures? These are the basic steps are as follows: cleaning, then enamel conditioning, then sealing, then priming, then bonding. First is cleaning. First, as is shown in the picture, ideal bonding procedure should be free of any debris. Cleaning of the teeth with pumice will remove the plaque and the organic pellicle that normally covers all the teeth. Here picture is shown that all the polishing bar is used to polish the tooth surface, so that it will be free of enamel or the free of any debris, and it should be a polished surface before the bonding procedure started. Then second is enamel conditioning, which includes the moisture control. First is salivation control. Salivary control and maintenance of a dry working field are essential after rinsing and drying. Many devices in the market accomplish this. First is cheek retractor. This is shown in the blue picture. Blue cheek retractor is as shown in the picture, and also saliva ejector, or we can use also the cotton and gauze for the salivation control. Here is shown in the blue. The suction tips are available for the saliva ejector. Then enamel free treatment. Before starting the bonding procedure, the tooth surface is pre-treated with the 37 treated with the etchant, that is 37% phosphoric acid for 15 to 30 seconds. At the end of etching phase, the etchant is rinsed off and of the teeth and abundant waters with the abundant water spray. And then after etchant, how will you know that the proper etchant etching will the tooth occurs? We will dry the tooth surface, the three-way syringe, and see the frosty appearance. If the frosty appearance is not there, the tooth is not etched properly. Then enamel etching. What is it creates the micro porosities within the enamel, reduces the surface tension that allows the resin to penetrate and polymerize within the etched enamel rods. Standard etchant dissolves about 5 to 10 micrometer of enamel surface. Also remove the fluoride surface layer that makes the enamel amenable for bonding. Removes all small amount of intraprismatic enamel. Open up pores between enamel regions. then if the etching is more than 90 seconds, insoluble calcium phosphate and salt crystals forms on the enamels and they are impervious to ringing and resulting reduced bond strength. Coming to the bonding procedure, first is transfer, then positioning, then fitting, then removal of excess, then curing. First is transfer. With the reverse action tweezer, we will transfer the bracket and uh, uh, the composite is taken. Applies some adhesive on the back of bracket bonding base for correct positioning of the bracket. Then second is positioning. Bracket positioning should be done with the help of bracket positioning gauge as shown in the picture, and it should be checked with the mouth mirror occlusally, so that as it is occlusally it is should be positioned in the middle of the tooth. If it is not in the middle, it will cause rotation of the tooth. Then use of height gauge during bracket positioning. In the incisor region, the gauge is placed 90 degree to the labial surface. Then in the molar region, the gauge is placed parallel to the occlusal surface of each individual molar as shown in the picture. Uh, then then it is a standardized bracket positioning chart for the adult and children. First table is for the adult, second is for the children. Then is the MBT bracket. MBT for the MBT bracket chart. First is the upper one is the blue line. Blue highlighted in the average is the 5, 4.55, 4.54 and 3, 2 for the central, upper central to 7th tooth, and same as for lower as shown in the highlighted in the blue marking. Then what happens if the bracket is not positioning correctly? If the axial accuracy of the bracket positioning error occurs, what happens? To achieve axial accuracy, it is necessary to visualize long axis of the crown of the each tooth. Then vertical accuracy. Vertical accuracy should be checked. If the vertical accuracy is wrong, then the tooth will intrude or extrude. And the horizontal accuracy, if it is not positioned horizontally, then it will cause rotation of the teeth. Then fitting should be done with the fitting should be done with pressing the bracket with the composite and firmly pushes forward the tooth surface. The tight fit results in good bond strength. If we tightly fit the bracket on the tooth, it will improve the bond strength. Then fourth is removal of excess. The excess should be removed on the scaler, hand scaler, or bar after fixing the bracket or before curing. Then fifth one is curing. After the correct positioning of the bracket is done, we will cure the bracket for 30 to 40 seconds for teeth. Then types of bracket. What are the materials used for the metal brackets used? Then ceramic brackets used. What are the ceramic brackets do? They bond to the enamel by mechanical retention, chemically by means of saline coupling agent. And the adhesive fluids are we are using the composite resins which is shown in the picture. Then it's a no mix adhesive, then light polymerized adhesive in the primer, moisture insensitive primers, self etching primer is the generations of bonding agents. Then bonding to fluoritic in enamel fluorosis condition, the the two surface will be polished before bonding. This is the first part of the bonding procedure. We will discuss the second part of the bonding. It is the self-ligating bracket. Uh, Self-ligating bracket. See how the orthodontist use the self-ligating brackets. How it is a reverse tweezer, um, and bracket is bonded after all the procedures are done, excess is removed, then uh, after correct bracket positioning it is cured. Then like this all is a self-ligating bracket. It has own ligation system, no need to ligate again after the wire is placed, because it has own lock system, lock and open system. It is very easy to place, and very short treatment time for the patient. All here is showing the all brackets are placed in that position in the teeth. In second part, we'll discuss the indirect bonding. Thank you. Thank you for your uh, kind attention. We'll meet at the second video of the second part of the bonding procedure of the video. Thank you.